It is normal to lose 50 to 100 hairs a day. If you are losing more hair, you might be experiencing hair loss. Excessive hair loss, or alopecia, happens when your cycle of hair growth and shedding is disrupted, or your hair follicle is destroyed and replaced with scar tissue. Hair loss can affect your scalp or the entire body. You can lose hair due to heredity, hormonal changes, medical conditions, or medications. Men, women, and children all can experience hair loss by taking medications and making lifestyle changes. However, it is possible to counteract hair loss. Having high stress levels can lead to particular types of hair loss. 2. Try to stay relaxed. Practice meditation, take walks, or do yoga. Consider writing in a journal to help sort through daily stresses. Hair loss from stress need not be permanent. If you can reduce your stress levels, your hair might regrow. Avoid tight hairstyles, such as braids, buns, or ponytails. Do not twist, rub, or pull your hair excessively. Be gentle when washing your hair with warm, not hot, water. Do not brush your hair too hard. A wide-toothed comb can help you avoid pulling out excess hairs. Minimize harsh treatments on your hair like hot rollers, curling irons, hot oil treatments, and permanents. Your hair shaft is comprised of 25% water. Drink at least 64 ounces of water, 8 cups of 8 ounces, per day. This will help you stay hydrated and assist hair growth. Sage is thought to increase hair density, while rosemary may stimulate hair growth. You can cook with both herbs. Try to use them weekly and buy fresh rather than dried rosemary. If possible, eating a nutritionally balanced diet will also help prevent hair loss. You also can mix rosemary with almond oil. Apply the concoction directly to your scalp and bald areas. Apply topical crude onion juice. Applying onion juice to one's scalp has been proven to treat patchy hair loss. The sulfur content in onions boosts collagen production and helps your hair to grow. Researchers believe onion flavonoids might have anti-inflammatory effect. Make a garlic and coconut oil concoction. Like onions, garlic has a rich sulfur content that can help regrow your hair. Coconut oil has plentiful essential fats, minerals, and proteins, which decrease hair loss and breakage. Garlic's iron and potassium levels make your hair stronger. Massage your scalp with jojoba oil. Rub the oil into your scalp and hair. Especially focus on areas with existing hair loss. Jojoba oil is an anti-inflammatory, which may be why it can help with some kinds of hair loss. You can find jojoba oil in health and wellness stores and in some grocery stores. Visit a doctor. If you are concerned about your hair loss, visit your doctor to discuss treatment options. There are a variety of alternatives, including medication, laser treatment, and surgery. Which option you pursue will depend on your budget, severity of hair loss, and available time. Take medications. The Food and Drug Administration, FDA, have approved 2 drugs to combat hair loss. The first, minoxidil, Rogaine, is a non-prescription liquid or foam available at drug stores. Both men and women can benefit from this drug. For women, this is the only approved hair loss medication. Twice a day, you rub the product into your scalp. The product works to grow new hair and/or to prevent additional hair loss. Finasteride, Propecia, is a prescription drug available only to men. One takes a daily pill. Many finasteride users experience slowed hair loss and some may have new hair growth. With both drugs, you must continue use for the effects to last. Consider surgery. For long-term hair loss, hair transplant or hair restoration surgery are options. If you pursue this treatment, your surgeon would remove small skin plugs, which each contain a couple hairs, from your scalp. She would then put the plugs into your bald spots. Use laser therapy. Both women and men can treat pattern baldness with low-level laser combs like Hair Maximum Laser Comb. The procedure is FDA approved. To treat your hair at home, you move the laser comb slowly from the front of your scalp to the back, and then from the sides to the center. A beep sounds every 4 seconds to let you know when to move. A recent scientific study proved that laser combs, applied 3 times per week, do improve hair growth. Identify how you are losing your hair. You might have gradual thinning on the top of your head or circular or patchy bald spots. Does your hair come out in fistfuls? Are you losing hair on your head or all over your body? Do you have patches of scaling on your scalp? Noting your symptoms will help you diagnose what is causing your hair loss. Discover the root cause of your hair loss. Hair loss can happen at any time in one's life due to many reasons. Changes in. Be aware of risk factors associated with baldness. If you have androgenetic alopecia, rather than hair loss caused by illness or trauma, understand associated risk factors. Men with alopecia are more likely to suffer from coronary heart disease, prostate enlargement and cancer, diabetes, obesity, and high blood pressure. Women who suffer from androgenetic alopecia have an increased risk of polycystic ovary syndrome,